Hi, I'm Kathy Fox. I'm going to be educating you today about strokes. My target audience is anyone greater than 55. The race can be any race. African American, however, are 2 times more likely to have a stroke than Caucasian. What is a stroke? How do you diagnose a stroke? What are the types of stroke? What are the risks of a stroke? How do you recognize a stroke? A stroke is an artery in the brain that becomes closed off. There's either a clot or the artery itself has ruptured. Blood can no longer get to the brain. Without proper blood flow, the brain will begin to die. Time equals brain. Diagnosing a stroke is vital. In order to treat a stroke, it depends upon the type of stroke, the source of a stroke, and the location of trauma on the brain. A stroke can be diagnosed by examining the patient, lab work, CT scan, MRI, or an arteriogram. Types of stroke. First, we're going to talk about a transient ischemic attack, a TIA, or a mini stroke. A TIA has no lasting brain damage. It comes on very suddenly and is usually resolved within 5 minutes. It should be taken very seriously. It is a warning sign of an approaching stroke. Signs and symptoms of a TIA: weakness or numbness to one side of the body, difficulty understanding or speaking, loss of vision or double vision, clumsiness to one side of the body. Another type of stroke is an ischemic, which is the most common type of stroke. A blood vessel to the brain becomes clogged, cutting off blood flow to the brain. There are 2 types of ischemic stroke: a thrombus, which is a clot that does not move but forms inside an artery that supplies blood to the brain, or an embolic is a clot that forms inside the body that moves through the bloodstream to the brain. If an ischemic stroke has been diagnosed, there is a window of opportunity between 3 and 4.5 hours that TPA, which dissolves the blood clot, can be given and hopefully restore blood flow to the brain. A hemorrhagic stroke, erupting blood vessels that empties into the brain. Ruptured artery is the most common cause of this. Manifestations are severe headache, vomiting, and a change in level of consciousness. Non-modifiable risk are gender, women are more affected than men. Race, African American, is 2 times more likely than Caucasians to have a stroke. Heredity, family history, past history of a TIA, a stroke, or a heart attack, and age greater than 55. Modifiable risk, which are risks that can be and should be changed. High blood pressure is the most common cause of a stroke. Diabetes mellitus, cigarette smoking, obesity and physical inactivity, atrial fibrillation, and sickle cell. How to recognize a stroke. Remember FAST, F-A-S-T, F, face. Ask the person to smile. Is their smile even? Is there a droop to one side? Ask the person to raise out their arms. Can they hold both of their arms out? Does one of the arms droop? Ask them to say something. Ask them to repeat a simple sentence like, the grass is green. Do you hear any slurring? Time. Call 911 immediately. Even if they only have one symptom, they need to be treated. Other signs and symptoms are sudden numbness or weakness of the face or arm or one leg. This is usually on one side of the body. Sudden confusion, trouble speaking or understanding, sudden trouble walking, dizziness, loss of balance or coordination, severe headache with no known cause. Some statistics for you. A stroke occurs every 40 seconds. Stroke is the number 4 cause of death in the United States. 40% of stroke patients are males, 60% are women. $73.7 billion was spent in 2010 on medical costs and rehabilitation. I'm going to leave you with this. Fast. Face. Ask them to smile. Arms. Ask them to lift their arms out. Speech. Ask them to speak. Time. Call 911. Get them immediate help. A stroke can be treated. Thank you for your time and attention.